According to a recent report released by the Office of the Healthcare Advocate in Hartford, Connecticut's current delivery system for mental health care and services is fragmented, inconsistent, and inadequate. There are too many barriers to getting services that could prevent crises. To tell you what the services we offer are and what some of the barriers are and how to navigate around them, we want to say to people then, if you have some concerns about mental health, emotional health, behavioral health issues, start with your primary care doctor if you have one, or your clinic.
Exactly. You want to have a medical evaluation. The first thing you want to do is speak to your doc. And let them know what's going on. At first I say, speak to whomever you can. Reach out to someone that you trust and know.
Yes,
because that's your first conversation.
Yes, yes.
And then you want to make sure you're talking to a primary care physician. You want to make sure you have that conversation with them, rule out that there's anything going on, that kind of get a differential diagnosis. Really kind of hone in on what's specifically going on with you.
So would it be okay then for someone to talk to the pastor at their church or to the counselor in their community group? Just reach out to somebody and share your concerns and say you're looking for some guidance for some help.
Absolutely.
And because that's the best way to minimize, before the problem gets bigger.
Exactly. I mean, many towns have their Department of Social Services. Well, they'll often have sliding scale fee or very, very low cost services that they can offer, whether it's short term or something a little bit longer term.
But they're also under these things we're talking about, especially for younger people. There's Husky and there's Husky Plus, and they're
federally qualified healthcare centers. I mean, it all meshes together, but this is very individual, and just like cancer is different in everybody, or these kinds of things are very individualized, so it's important that there's many different avenues.
Okay.
As confusing as that might be, there's many doors.
Think about a last thought after we go around. So Jen, what's how do people break down or navigate the system to overcome some of the barriers that are inherent in the system?
Actually, from the adult side, I think sometimes the simplest thing to do is, I'll get in trouble over this, calling the central office of DEMAS if you're really having trouble. You would be amazed at what they will do. From there, they have a consumer rights advocate, and I can't remember everybody's right titles, but you can just call. So
there's a consumer rights advocate at the DEMAS office.
Well, there is. I don't have the title correctly, but there's two people who essentially are dealing with consumer issues who are at the central office, work for the commissioner, and if you call 418-860-418-7000, which is the main number for the Department of Mental Health.
418-460.
860-418-7000, which is the main number for Department of Mental Health and Addiction Services in Hartford, and say you want to talk to the Director of Consumer Services.
Yes.
I'm not sure the title, but there's two people there who will do everything they can to try and direct you to the right person.
Okay, and if you're concerned about cost, there's also a toll-free number for DEMAS, and that is 1-800-446-7348. And again, we encourage you, if you don't have a computer at home, to go to your public library and sign up for a membership. It's free, and you can use the computer there, and they will teach you how to use the computer. What do you have to say to help us to get over barriers?
Well, I would say the first thing, obviously what Remi said, you talk to someone you trust. That's the first thing you can do. That person can often get you help if you think you can't do it yourself. The other thing we often find is sometimes when people have reached out for help, then they have problem finding a provider. Even sometimes people who don't have doctors right now. Many people aren't even don't have a primary care doc. You can call us. If you're covered by insurance or Medicaid, we can help find you a provider. You can call Husky, you can call DEMAS, you can call. So there's that kind of stuff out there that I would suggest.
The Mental Health Association
the Mental Health Association line.
And 211 will direct you to also
That's correct.
OHA, Connecticut Legal Rights Project.
We must remember that. The statewide referral. You don't have to dial an area code, just 211, and just tell them what is happening, and they will know where to send your call.
Where you live and what you're looking for.
Right.
And you'll find a lot of what you're referring to actually in their system, which is wonderful.
Right.
You know, in Hartford, there's something called Volunteers in Psychotherapy.
Right.
Yes, there is.
And they take no payments. They take no payments. In the interest of time, we want to give you the phone number is 860-233-5115. The website is the 3Ws.ctvip.org. And they take care of people, and then the people in turn do community service.
Right. 4 hours of community service for every hour of psychotherapy. It's wonderful.
That's a fantastic thing. It means that if you're in this area, or if you're in their catchment area, and you're having problems and you need psychiatric help, psychotherapy, they will evaluate you, they will provide services, and the only payment you need to make is to commit 4 hours of community service helping in the community. And I think that is a wonderful, wonderful thing.
The other thing, though, is I think it's important to point out to people that if they're feeling like they have an emergency going on, they shouldn't, they shouldn't wait, right, to deal with it. We do have services in Connecticut. Obviously, if it's an emergency, you should deal with
911,
calling 911 or going to the hospital. But also, we have a service called Emergency Mobile Psych Services in Connecticut, EMPS.
EMPS?
And that is, you can get through 211. And if there is an emergency.
So if you call 211 and ask for EMPS?
They will connect you and send someone out
and that's emergency psychiatric care?
Yes, correct. In the home. They go to the home and they intervene. And try to prevent unnecessary, hospitalization, or to, treat the individual right there and get the situation under control.
To prevent unnecessary interaction with the police.
Correct.
Yes.
May or may not be trained in how to diffuse the situation.
That is, I'm so glad you mentioned it. We are in the last 30 seconds, but it is so important to say that, because so often people with mental health problems end up arrested, end up sometimes going to jail, end up even going to prison if they don't get a the right kind of support system where someone can advocate for them and plead their cause, if you will. They might end up in jail, which is a much more expensive proposition for us as a state than if they get treatment and support.
I think it should be aware that Connecticut does have a very good statewide jail diversion program that does assess
and
people.
they started from the juvenile. They have the juvenile review board from young ones all the way through. Yes.
Okay.
No, go ahead.
No, I was talking about the adult one.
Yes,
they actually have staff, mental health staff that go into the courts
and actually do evaluations.
So you're saying that it's not as bad as it seems. There is help out there if people know where to look.
And I'm saying that Connecticut has been making an effort to try and address a lot of these barriers, but there's still many of them still need to be addressed.
Right.
Okay, I thank you all so very much. My thanks to Vicky Veltri, Jan Van Tassel, and Remi Kyek for shedding light for us on this topic. At OneWorld, our motto is, it is better to light a candle than to curse the darkness. We like to light candles of information for the community. And on this one, speaking about mental health, access, and barriers, I hope we have lit some candles of information for you tonight. Visit our website as oneworldpi.org. And again, 211 is always a place for you to turn when all else fails to get information. Good night, everyone.